Good morning. Thank you for joining us today on this webinar about using non-dilutive funding to advance your technology in your company. If you'll give me 1 second, I will start screen sharing our presentation and we will get started here. Okay, so welcome everyone to our webinar about non-dilutive funding. As a little bit of background, I'm with Eva Garland Consulting, and we're a company that exists to help others obtain and manage their non-dilutive funding to support scientific advancement. We have a long track record of success, and we've also got some resources available for you. In way of background, my name is Dana Upton. I did my PhD in molecular genetics and genomics, and I got my MBA in healthcare and marketing. I've been working with small businesses for over 10 years now, helping them with their overall strategy, especially their non-dilutive strategies. So let's talk a little bit about why you might want to go after non-dilutive funding. I know everyone wants to go after venture capital, but let's talk about why that might be just part of your strategy. There is a bit of a myth that everybody can just easily access venture capital, and that's not the case. It's a very small percentage of startups that actually do receive VC funding. And while it's a little bit easier to apply and get looked at, it's a very low number that receive the funding. And even if you're successful, it can take you up to 9 months to raise VC funds. We've also noticed some trends by sector where there's certain types of technology that are more popular with VC funds. And there's also some geographic areas where you're more likely to receive VC funds than other geographic areas. We've seen very little VC funds being directed outside of California and Massachusetts in the life sciences. So that's just something to keep in mind, that geography might impact where you're getting your VC funds. The other thing that might make VC funds not entirely right for you is the area of product development that they focus on. What we see is that most companies where they really need the money, they're in this valley of death for product development, where they're really trying to get to proof of concept and really focus on the technology development, whereas the VC funds come in once you're ready for early commercialization. So something that we've seen be successful is using non-dilutive funding to overcome this valley of death. So just looking at non-dilutive funding in the US, there's billions of dollars that are available. It's both on the government and the private foundation area. One thing that we particularly wanted to note are the SBIR, STTR funds, which are set aside for small businesses. It's a legislated set aside, that's hard to say, of about 3% of all federal agencies funding. These are grants and contracts to really help support that product development. And we're going to talk more about these in a minute. I just wanted to point out there's all sorts of agencies and all sorts of foundations that might have the funding that you need to support your small business. So in terms of SBIR and STTR, these were established back in the 80s and the 90s. It is meant to be federal funds to meet R&D needs. It's one of the only programs that's received bipartisan congressional support for nearly 40 years, which is astounding. The objective is to keep the US at the forefront of innovation. And so they want to use these funds to really help small businesses that are going to do innovative research right here in the US. We've seen that the number of small businesses getting SBIR, STTR grants is much larger than those receiving the VCC deals. So that's just something to keep in mind about why these might be an attractive source of funding for you. And as I mentioned before, it's about $3 billion that's set aside each year for non-dilutive funding for small businesses. It's a very well-defined path that they want you to be on for these. So phase 1, concept development, early proof of concept. These are about 6 to 12 months long. And depending on the agency that you're applying to, the dollar amount can vary. But on average, we're seeing between about $100,000 and $314,000. I will note that if you're going for NIH, the 314 can be much larger. So just something to keep in mind to look into the budget waiver topics at NIH. The phase 2 is more about prototype development and the R&D that you need to do to get towards commercialization. Those are about 2 years long, and most agencies, it's about $750,000 to $2 million. And then phase 3 would be the commercialization. There's not much SBIR funding available for those, although you might see some programs within the DoD that call themselves phase 3. What we're really talking about here is once you've used those SBIR, STTR funds to push into commercializing a product. I will note that this is the pathway for SBIR, STTR. There's other money available to small businesses that's not a specific set aside. We're going to talk about some of those a little bit later, but you might want to look at the CDMRPs. I'll bring that back up later, and the ARPA-H opportunities. There's about $100 billion available each year for translational stage technologies. So it's something to keep in mind. One reason that I like SBIR, STTR funds is that you can work on a bunch of different projects at once. Oftentimes when you get VC funds, they want you to focus on one product. Let's focus on that lead product in your pipeline and put all available resources towards getting this one thing commercialized. Whereas SBIR, STTR, and other non-dilutive funds, you can work on a couple different products that are in your pipeline at once and try to support all of them. So rather than focusing on a single vertical, this might give you the opportunity to explore multiple paths of R&D for you. There are a couple of myths around SBIR, STTR that I did want to address. And the first one is something I hear folks say all the time: I'm just too small. I need to be bigger in order to get these types of grants. And that's really not the case. About 50% of these types of grants are going to folks that have 5 employees or less. Odds are pretty much in your favor. I would suggest that you really look at this. You want to have enough folks on your team to be able to do the work, but they don't necessarily have to be employees. We're going to talk more about that in a couple of minutes. Other folks say, hey, I've got something that's just too specialized. I don't fit into any of these programs. Some agencies have very broad interest. Talk to a program officer and just say, here's what I'm wanting to do. I was thinking about applying for this. Do I fit with what you're looking to fund? Do you have any other suggestions for me on where I can find funding? And then there's also the idea, well, if I've got any sort of involvement with a university, I've still got this academic appointment that I can apply, and that's not the case. The company needs to be the prime applicant, but that's not to say that academics can't be involved. They can even serve as PIs and co-PIs in some cases. So what we're going to talk about next is a well-known example of a company I'm sure everybody's heard of that was very successful in getting SBIR, STTR funds, and that's iRobot, those fun little robot vacuum cleaners. And I love this quote that was, we were trying to do something so risky that no rational investor would give us money. But they found that the SBIR and STTR program was the way to go to get that early funding that they really needed. Looking at non-technology companies like this, but looking more at biotechs, I bet there's some names on this slide that you're going to recognize of folks that were very successful in using SBIR, STTR funds. So as I mentioned earlier, I work with EGC, and we were founded over 10 years ago now. Our mission is to advance science. And one way we do that is to help folks go after these non-dilutive funds. I do a lot of SBIR, STTR things. And one thing that we've observed is that of our grant-funded companies over the past 5 years, 99% of them are still in business, whereas about 4 out of 5 companies failed within that same time frame traditionally. So it's something to keep in mind that this is a really good way of getting funding to help keep your business afloat and to get the money that you need to advance your technology. Some of the resources that we have available for entrepreneurs that are going for SBIR, STTR funds. One of our big ones over the last 5 years was the AAP. This was the National Institutes of Health Applicant Assistance Program, where we provided coaching. We gave them some of our books, and we're going to talk more about that in a minute. And we also helped facilitate conversations with the program officers at NIH. These were for first-time applicants or for applicants who had applied but never been successful with the NIH SBIR STTR program before. And so we recently published our article in Nature Biotech about this over the summer, where we found that we were able to make a significant impact on increasing the number of awards to women and to underrepresented groups. And the other thing that we found with the ones who got the phase 1 awards, most of them went on to get phase 2 awards and then other sources of funding. So they used that phase 1 to then get far enough along that they could attract angel investors, VC, and other sources of private funding. So this program has ended now, but we've got a couple programs that are replacing it. One of them is NCI STEP, which is somewhat based on AAP, with the addition of a 6-week entrepreneurial course in front of it that looks a lot like NIH I-Corps. It's currently running for folks that are applying to the NCI SBIR STTR for April 2025. I will say that it will be offered again in the future, and we'd love to see your applications for the September cohort. Those will open in the spring. Again, this is for folks who are applying for the National Cancer Institute. If you're maybe not interested in NCI, but you have something that would be more in line with the National Science Foundation, we're also running a program for female-owned companies that are applying for their NSF SBIR STTR phase 1s. We're calling it the WINS program, Women in NSF SBIR, and you can find more information about this one on our website. So let's talk about some of the keys to success for obtaining this type of funding. And one thing that I say to keep in mind is that this is part of your overall strategy. It's not the entirety of your strategy. So they don't want to see folks that are chasing just grant after grant after grant and really not taking anywhere. But the SBIR STTR program really wants to see that you're leveraging these funds and advancing your technology, and it's part of your overall strategy. One thing that you might want to keep in mind is what I do to be successful is I start at the end. What does my end product look like? And then I work backwards, figure out what those steps look like, and then I can start carving out specific grants based on each of those steps. We've been talking a lot about SBIR, STTR. Maybe that's not the right fit for you. So let's talk about some other things that are available. So there are academic grants. Check the funding opportunity announcement, but I bet you'll see that you can apply as a small business. So what this might look like in terms of the NIH, some of the grants, the academic grants that you might be familiar with, like their R01s, their R21s, their R03s. They have other things available as well, like their Blueprint MedTech, or their BPN, or Brain Initiative, or Heal Initiative. You might want to look into these and see what's available for you at the NIH. NIH also has free resources available. If you have experimental therapeutics for cancer, you might want to look at NCI Next. If you've got something for a rare disease, maybe look at NCATS. Look at the agencies, talk to the program officers, and find out what's available that you might be able to use. The NSF has other grants available beyond SBIR, STTR. ARPA-H is a great source of funding if you're working on something biomedical related. I would strongly suggest you take a look at ARPA-H as well. And then you've got the Department of Defense congressionally directed medical research programs. A lot of times folks hear DoD and they think, well, I've got a medical technology, but it's not something a warfighter can use. There's nothing available for me at DoD. I'd strongly suggest you take a look at the CDMRPs. These are on a wide range of topics, and they're looking for things that would affect veterans, warfighters, military families, the general public as well. So there might be something there for you. It's also a great time of year to start thinking about CDMRPs. Most of them will open in the spring, and so it gives you plenty of time to start thinking and looking and planning. They're always slightly different from year to year, so don't go off of an old solicitation, but do take a look at them. So in thinking about where do you want to apply, I'd say start with understanding your own requirements. What are the key products that you're looking to develop? Have a very clear idea of what you want to do. And then think about, well, are you working on different products? Or do you have one thing, but different stages of technology or different stages of development that you need to fund? The other thing I'd suggest is looking at what can you do in-house versus what will you need to outsource. That sometimes can be very important in thinking in terms of how the budgets work for these things. Not to say that you can't outsource, but just have a clear idea of it going into it, what you can do and what you can't do. Do you need collaborators? Do you already have the collaborators? I've found that some universities require a very long lead time if you want to collaborate with them. For example, well, I'm in the Research Triangle Park of North Carolina, so you can guess the types of universities that I work with on a daily basis. And there's one of them in this area that's very well known for saying, hey, I need 4 months to process this award. Well, if you're going to go for the April NIH deadline, that's plenty of time. But if you're thinking about going for the January deadline, maybe it's too late and we need to come up with an alternate plan. So just be aware of your academic collaborators' needs and timelines. If you don't have a collaborator already and you identify that you need one, that's something you can start working on, is figuring out who can I work with on this. What's your timeline? Mentioned earlier, it could be 6 to 9 months to get VC funds. It sometimes can be that long, if not longer, for some of your grant funding as well. So it's just something to be aware of, that none of these things move very fast. Can you offer cost share? Some grants do require cost share, so it's something that you might want to take a look at. I will say that most don't, but you're going to want to read the solicitation and make sure that you know what the requirements are. Do you have any strong feelings about the agencies that you want to work with or that you don't want to work with? For example, I've heard, oh, I would love to get an NIH grant. In my field, that NIH success story is something that is really valuable and is a way that I can brand myself as I've been NIH vetted. Or, oh, I don't want to work with that agency. I worked with them before and I just found the reporting requirements to just be too onerous. I'd also suggest if there's somebody that an agency that you don't want to work with, really explore why you don't want to work with them and see if maybe you can find a way to embrace some of the opportunities that come with that agency. I often hear, I don't want to work with the Department of Defense. I'm not doing something for the military. And when people start looking at what they fund and at those CDMRPs, they have a change of heart. And then also, how comfortable are you with letting an agency provide some input on your research or on your team? I mentioned some of the NIH examples that were not SBA or STTR. They do a lot of U grants and U contracts. For example, a U44 is a type of SBA or STTR where you're expected to have a lot of back and forth with the program staff, and you can use NIH contractors. I'm thinking specifically of the BPN U44. But the NIH is going to want to have that conversation and maybe want to provide some input as well as how you've designed this program. That is a great opportunity for some folks. And some folks say, not for me. I want to have more control over this. So just understand your own requirements, and then you can start looking at the agency requirements. But at the end of the day, the main thing you need to answer is how much money do you need? And doesn't necessarily have to be in cash. For agency requirements, things that you're going to want to look at, eligibility requirements. What registrations are you going to need? How much money is available? What are the instructions that you have to follow? Are collaborators allowed or are they required? How are they going to grade your application? And so that's what I mean by score driving criteria. understand how your application is going to be scored. And I think that's one of the key things to keep in mind for how to be successful. Do you need preliminary data? How much preliminary data? For some of these, you're going to have to require a lot of business information, and some of them maybe not so much. So just understand the agency and see if you can find a match between your requirements and agency requirements. I will say be persistent. Don't take a no. That doesn't mean stop. It means try again. The other thing to go along with be persistent, multiple shots on goal. Put in a lot of applications. I come up with strategies where I'm applying to something every couple of months. I've always got something in the works. Maybe I put it in for NIH in January, and then I put it in for DoD with a slightly different twist in the spring. Or this aspect of my technology could go to NIH, and this aspect can go to NSF. Just think about how can I get multiple shots on goal, and make yourself a little timeline, a little Gantt chart showing what your opportunities are, when you need to be working on them, when you need to apply, and when you can expect your funding. The other key for success is give yourself time. Set aside plenty of time to prepare. The Small Business Administration suggests that it takes 100+ hours to put together a phase 1 application. In our books, which are available on Amazon, we lay out timelines. So for example, the title of our phase 1 book is a 10-week plan for preparing your application. That's a phase 1 application. In our phase 2 book, we lay out a 12-week timeline for how to put together your NIH phase 2 application. So give yourself plenty of time. And one reason you need plenty of time, company registrations. Some of these, especially SAM.gov, can take several weeks to get. Some of them you can get same day, like grants.gov and that Small Business Administration, SBIR.gov registration. ERA Commons, I've seen everything from a day to a month. Most of them take around a week. So this is not something you want to wait till the last minute. So earlier I was talking about assessing your team. Think about who you're going to need, both for broad expertise in science as well as commercialization. These don't all need to be employees of the company. So you might reach out to key opinion leaders to provide letters of support or to serve as consultants on a project. You might have academic collaborators. For a lot of these things that are going to be going to the FDA, you might want to pull in your regulatory consultants and those regulatory experts sooner rather than later. I find it's always helpful to have a plan for regulatory, even on a phase 1 application, even if you're years away from it, just so that you know the road that you need to walk. If you have investors already, that is great. That can really strengthen a phase 2 application if you can get a letter from an investor. But it's just something to keep in mind. You also have business advisors. And I'm not saying any of those folks need to be actual employees, but it's good to have this network around you as you're putting your applications together. And again, strategic partners always play a place. So be able to define your impact. They're wanting to see groundbreaking innovations that are very clearly differentiated from your competitors, and that you're meeting some sort of societal need. There's an unmet need and an associated cost that you're able to define. And a really good example of this one, we have the wheel. It's been around forever. You can do a lot of work around a wheel that's iterative, but it's not really groundbreaking innovation. But then we have a car come along. It is the next groundbreaking step in what to do with a wheel. So they're looking for innovation and impact. Really understand your budgets and how to maximize your funding. There's different pools or buckets of money, if you will, within some of these grants. So direct cost, those things that you're doing to pay to do the R&D work. And direct costs would be more like general company expenses, overhead, administrative things. And then for SBIR, STTR funds, there's what they call a fee. It's profit. It's, hey, here's extra money that's not earmarked for anything. Congrats on your SBIR, STTR success. Most of the times the budgets given for SBIR, STTR are on total cost, whereas a lot of the academic grants, you're going to see it on direct cost. So make sure that you understand what you're applying to and what your budget actually is. So for example, here we've got 150,000 earmarked for directs, about 60,000 for indirects. You've got your fee on it, and that's how you get a $225,000 total budget. So the solicitation listed $225K. Of that, $150K is your directs that you can use on doing the science. So understand this, get help with your budgets, and start on them early. But really, it's a great way of getting funding to do the work that you need to do for these projects. So the keys for success, it's part of your overall strategy. Start with a project and work backwards to define what you need to do within a project. Be persistent, multiple shots on goal. Give yourself plenty of time to work on these applications. Build a strong team around you and be able to clearly define your impact and your innovation, and then just embrace the funding that's available to you. So in terms of some success stories, companies of all sizes can be successful going after SBIR, STTR funds, and other non-dilutive funds. So some examples that we've seen of folks that were really successful within the SBIR, STTR program, and for other non-dilutive funds that are more healthcare related that you might recognize. And I want to talk through a couple specific examples. One of them, they had a great amount of investor funding, but it was really only for their lead product, which was in depression. They got SBIR funds to support other things that were in their pipeline. And then when the lead product was sold off, then they had other things that they can continue working on through this new spin out that eventually went to an IPO and went public a couple of years ago. Thymune was another great success story of they were developing an off-the-shelf stem cell derived therapy. They got NIH SBIR funds to support that. And then they went after one of those very large ARPA-H projects and received funding for that. And now they're working on immunosenescence. So Transmural also has had a lot of success within the SBIR or STTR program for getting funds to support their technology that would have really struggled to find investors because it's for small markets. For example, a cardiac disease that affects very small children with very low numbers of people affected each year. Might be a little bit harder to get investor funds at early stages, but NIH is very interested in funding work like that. So again, the non-dilutive funding model, there's billions of dollars available out there. It supports high risk, early stage technologies. It's a supplement to other funding sources. And a lot of times folks get these SBIR, STTR funds or other non-dilutive funds and then leverage them to go after the investor funding. And the non-dilutive funding can help you bypass that valley of death. So I'd like to thank the team here at Eva Garland Consulting. And I'd also like to thank Health Wildcatters for giving me the opportunity to chat with you about this today. As you know, Health Wildcatters has a huge reach and has a large number of companies in their portfolio, and they've been very successful in helping accelerate companies. So if there's anything that you need, your contact is Jovelyn at Health Wildcatters, and I thank you and hope you have a great rest of your day.